Welcome to Newsmakers. I'm Andrew Donovan. May is Lyme Disease Awareness Month, and it seems that every year we learn more about how hard Central New York is hit by ticks. Joining me now in the studio is the Executive Director of the CNY Lyme Alliance, Melissa Carr Rowe. And joining me from Upstate Medical University, one of their facilities in East Syracuse, is the organization's Chief Medical Officer, the Chief Medical Officer of the CNY Lyme Alliance. Also an upstate doctor, Dr. Kristopher Paolino. Thank you both for joining me today on Newsmakers.
Absolutely. Thanks for having us.
Doctor, let's start with you. I think the major headline related to ticks is this apparent spike in emergency room visits from tick bites. What are you seeing at Upstate?
So I can only comment on what I see in my clinic, but many of my Lyme patients have noted increased tick bites and tick exposures over the past couple of weeks. Several patients have identified multiple tick bites just in the past week or two. So there's definitely an increase, at least anecdotally, from my experience, and that's kind of what I've been hearing from the region as well.
Do the emergency room visits, the information gathered, end up in your clinic? Can you speak to what the ERs specifically are experiencing?
I can't speak specifically to that. I haven't seen those numbers. Again, I've only heard from what people have been talking about. A lot of tick exposures and specifically tick-borne diseases, that data isn't compiled for another year or two after the season is completed, and that's usually done by the state or local health departments.
And Melissa, what are you hearing from people within the community about what emergency rooms, hospitals, doctors are seeing?
I think what people are saying is that they're first more aware that this is an issue this year because everybody's out and about right now. We didn't have a really big winter thaw this year, so we had a lot of opportunities to get out and about earlier. So even anecdotally, people are saying that they're seeing more ticks as part of, their daily activities, and that has raised awareness for the issue. And I think also people are saying there's been more bites this year in their own personal lives. I know that we've gotten quite an influx of phone calls looking for information and questions.
Wow, I know you're new to this role, but is there data to suggest you're getting more calls than ever?
We don't really track the number of calls that come in that way. However, I can tell you that our education team has had a lot more requests to go out and do education sessions, community events. We do all the way from K-12 to adult senior centers all across the board. And we have a very packed schedule right now, which is telling us there's a demand for that information.
Yeah, doctor, how often does a tick bite result in a virus, whether it's Lyme or something else?
So it's kind of hit or miss. I can give you the data that Dr. Tangamani has produced from his tick collection studies. About 30 to 35% of our ticks in the region are infected with Lyme disease. So about a 1 in 3 chance based on his data from a Lyme perspective. That does not include things like anaplasmosis and babesiosis, which are around 10% of the ticks that we have. And then there's some other infections that are more or less rare incidents that we'll see.
So you and Melissa have both given me anecdotal experiences already this summer. What do you think that means for the season ahead?
I think it's going to be a busy season. I think one of the things that people have thought over the years is that the cold winters will help prevent a bad tick season. And in a sense, that is correct. I think the colder winters are generally worse off for the ticks and the rodents that carry them. The problem is we live in Syracuse and we get a big snowfall and there's a large snowpack that covers the leaf litter where these ticks are trying to overwinter. And I feel that our big snowstorms this year as well as last year have probably allowed more ticks to overwinter successfully. And in addition to the fact that, as Melissa pointed out, people are getting out and trying to do things, it's putting more people at risk, and that's where we're seeing more of these tick bites.
Melissa, do you see this shaping up to be a pretty dangerous season in terms of tick bites and Lyme disease spreading?
Unfortunately, yes. We have heard anecdotally, even from our colleagues at the tick lab, the testing lab, that they are seeing more ticks being submitted for testing, and people don't submit them generally until after they've had a bite, right? So I think it's important to kind of think about that context and understand that the best thing that we can all do is prevention. We stand on those 3 pillars of prevention, education, and advocacy at the Alliance, and so getting you the information to keep you from being exposed in the first place is the most important. If you are bit and exposed, to get you the information about what to do, and if you do happen to fall ill from that, to make sure that you have the resources and understand what those steps can be in the process.
I do want to spend some time talking about prevention, but I want to stay on this hospital situation for a bit longer. Dr. Paolino, is the ER a good place to go for a tick bite? I know ERs are often overrun. People often go to ERs when they could be going somewhere else, maybe for a less emergent situation. Does a tick bite ever need to require an ER visit?
So, honestly, a tick bite is something that a patient can remove on their own. If a tick's been attached for less than 24 hours, the risk of any kind of transmission from Lyme or some of the other tick-borne diseases is decreased, not necessarily zero. But patients can remove these ticks at home. I generally recommend using some needle nose tweezers and putting the tweezers right at the base of the skin and pulling from the head directly out from the skin, and that will remove the tick. You don't need a medical professional to do this necessarily. And the big reason that somebody would need to be seen in the emergency room is if they were having symptoms after a tick bite, or if perhaps the tick was attached for more than a 24-hour period. There is some data to suggest that a 200 milligram dose of doxycycline can potentially prevent many cases of Lyme. Again, not 100% protective, but an option that emergency rooms, urgent cares, and primary care physicians can potentially help with.
But I think the advice would be, if you can go to your primary care doctor, probably go there, because the emergency room should be reserved for something more serious. Is that fair to say?
I think that's fair to say. Yeah, I would try to utilize either your primary care physician, or if you have a local urgent care that you can get to easily, that would be another place that you can reach out to.
And it sounds that some urgent cares in the area are actually increasing awareness and training within their staffs. Is that something you've heard, Doctor?
Yeah, I've actually done some training just this past week, as well as some other periods of time over the past couple of weeks for emergency room physicians, urgent care providers, to try to update them on the risks of Lyme, as well as some of the other tick-borne diseases that we're seeing.
And I guess before I go to a break, I do have one more question about that. I think if I was bit by a tick, I would panic, and then I'd probably go to an emergency room or an urgent care at the least. Is your advice not to panic?
I would say not to panic, especially if a tick has only been attached for a few hours. The likelihood of anything transmitting in that situation is pretty low. I would remove the tick. You could send the tick in to Dr. Tangamani's lab here at Upstate, and he can do some testing if you choose. But the other thing I would say is, reach out to your primary care provider and get some information from them in terms of what their recommendations would be. They may just recommend to watch it. They may recommend a short course of that doxycycline I mentioned. It really depends on how long the tick is attached.
All right, we'll take our first break. We've got a doctor and an executive director, both related to the CNY Lyme Alliance. We'll have more with both of them on this important conversation when Newsmakers continues. Newsmakers is back. We're talking about Lyme Disease Awareness Month and other tick-borne illnesses. Our guests are Melissa Carr, the Executive Director of the CNY Lyme Alliance, and Dr. Kristopher Paolino of Upstate Medical University, but specifically for the Alliance, he's the Chief Medical Officer, an important role for both of you. Melissa, we heard Dr. Paolino talking about not to panic if you're bit by a tick. And he was mentioning tweezers that might be helpful. You happen to have some with you.
Of course I do. We are excited to be able to offer tick removal kits to the community all year round, but particularly during Lyme Awareness Month, during May, we are all over the place distributing these. And included in the tick kits, you will find those fancy tweezers that Dr. Paolino was talking about. So these are long needle nose tweezers, and the goal in removal is to get as close to the skin as possible to grab and pull straight up instead of at an angle or otherwise coming in. You want to grab as close to the skin as you can so as not to smash the tick, right? So important to remove it safely, and when you do, save it. Put it in a Ziploc bag, date it so that you know when you've removed it, and should you develop symptoms, then you can make a decision what you'd like to do in terms of testing or otherwise.
Can you send it in if you don't develop symptoms, just to be part of the broader research on how many ticks do or don't have diseases, or resources limited where a lab would only test if it came from a symptomatic person?
No, anyone can send a tick in to the Upstate Tick Lab for testing. Onondaga County residents do have a subsidized cost on that, and outside of Onondaga County, there is a different price that's not subsidized by the county. But anyone can send a tick in from anywhere. Most often, people do send them in after they've been bit, obviously, but certainly as if you happen to find one that you want to have tested, you can send that in. It's really an interesting report that they provide back, so they tell you the genus and species, the gender, sex of the tick, and what different pathogens are detected, and they have a whole variety of different things that they can test for in addition to Lyme. So it's helpful. Most important, though, is to get the tick off of you quickly and save it. If in a Ziploc bag, just put the date on it is fine. And then it can be dropped off or mailed in to Upstate's Tick Lab if you decide to do that. Information's on our website as well as their website to be able to do that.
You heard the doctor and I speaking about if I had a tick, I would panic and rush. He said not to panic. And I also asked how he would suggest people go to the urgent care versus the emergency room versus primary care. As the executive director who probably fields questions like this all the time, what would you say on those topics?
I think typically the first conversation you should always have with any concern like that is your own physician, right? So hopefully you have a good relationship with that physician and that they are literate in the issue so that they know how to treat that. So that should be almost always the first call for any health concern, right?
Although, what if it's a Friday night, hike in the morning on Saturday,
Sure.
now there's a tick on you, my primary care is not open till Monday.
Yep. Fair question. So if you can call them after hours, certainly do that, right? Because that's where your relationship is established. However, we are very fortunate in this region to have some great urgent care centers who can also provide that service to you. And as Dr. Paolino mentioned, he's gone and done training with many of these folks to help them become clear on what the current treatment recommendations are. So we do have on our website as well a list of Lyme literate MDs. So if you are in a situation where none of those things are working for you, you can see a list of folks who have attended our annual clinical summit and have received specific training in CMEs in the treatment of Lyme and tick-borne disease. So that's always available too.
How alarming the doctor's stat that 30 to 35% of ticks in central New York are positive for Lyme disease.
Mm-hmm. It's scary, right? Because that number has continued to increase over time. If you look on a national level too, central New York's a bit of a hot spot. So I think the sense of panic is fair and real, but we want people to be safe and understand that this is the most beautiful place on earth, and we want you to go out and explore it and see it, but to do so safely so that you're able to protect yourself in that way.
Doctor, how did central New York become a hotspot for ticks? What about the ecosystem, the environment, has created this issue for central New Yorkers?
You know, I don't know if there's anything in particular that has occurred here. I think the hotspot was really kind of more in southern New England and along the coast, in the mid-Atlantic, New York State, and it's just kind of moved inward. And I think, regardless of your stance on climate change, I think that is playing a role. We're starting to see ticks in our region that have never been here before, and so the only real reason I could explain would be the potential for some kind of climate change that's occurring.
How do we stop it, fight it? What's the game plan, both of you, in charge of helping us fight through this? I mean, we'll talk more about prevention in a moment because that's important, but what the root problem is removing ticks from society, and is that even a reasonable option? Doctor, I guess I'll start with you.
The ecology of the ticks is not really my field, but from what I have heard from folks in the know is that the ticks are here to stay. And we need to do a better job at preventing the tick bites and educating people and coming up with other preventive measures such as vaccines and other preventive treatments that can help prevent these infections from taking hold.
Is there any headway on a vaccine?
There is, so Pfizer and Valneva have partnered to produce a vaccine. It's been in phase 3 clinical trials, which have completed, and they are in the process of compiling the data and submitting a package to the FDA. So the last I had heard is that Pfizer was anticipating a potential early 2027 approval if everything goes well. But again, that's all dependent on, how the reviewers at the FDA and ACIP and other organizations view the data.
Executive Director, I know it's a brutal expectation for us to have that you and the doctor can fix this for us, but what is the fight look like to cut out the root problem, which are ticks?
I think our mission at the Alliance, we start with the prevention piece, right? So while we do tell people to do things like have repellents and, for example, clothes that have permethrin in them and different insecticides that can keep the ticks away from you as a human, we have to leave that space to the environmental genius that can take care of whether or not that's something that's real. As Dr. Paolino mentioned, it's a tall order. It's a big question. Can they be removed from the environment? And the answer is probably no right now, or probably for the long-term future. So we have to coexist in a way that's not causing damage to us.
Some of these towns and villages have sharpshooters out shooting deer. I mean, is that, I'm sure, PETA's not going to like that I'm even asking that question. Is that a reasonable step to reducing ticks, or are ticks here without the deer?
The ticks are here without the deer, and we have to remember that it's not just deer that can bring the ticks in with them. So any animal, small animals, mice, any of the things in the raccoon category, all of those animals that we think about as the small woodland creatures, they're all potential hosts. So we have to remember it's not just the deer. The deer are a piece of that, and they have established migration patterns, if you will, but certainly that's not the only thing. I think there's a lot of different schools of thought in how to go about keeping the ticks away from the human population. We start our mission with the prevention piece because the piece of keeping them out of the environment is outside of our scope, really.
Sure, It's a tall order.
It's a tall order.
I'm not sure anyone has figured out.
No, no.
We'll take another break. More with our guests when Newsmakers continues. Newsmakers continues with our guests from the CNY Lyme Alliance. Melissa, can you treat your lawn to remove ticks? Is there any kind of chemical treatment that's been effective to reduce ticks in the lawn?
What we tell folks when they ask that question is you should defer to the professionals. So it's not something you want to do yourself in your own yard and messing around with chemicals in that way. And there are many pest control agencies in Central New York that are certified and able to do that work for you. That in mind, though, we do have on our website a great infographic about ways that you can landscape your yard to deter ticks from coming into that space, right? So you can do things like create a cedar mulch barrier around the outside of your space, keep your grass trimmed low. There's certain types of plants that are natural deterrents to ticks, and there's a list of those all on our website. We partnered with the Home and Garden Show recently, for example, and offered some instruction to folks about what to choose as you're considering what you plant. And this is a big time of year for people. I know at my house, Memorial Day is a big planting day. Everyone's out and we're putting all kinds of things in. But think about what you place and where, and we do have an infographic design available that can give you some thoughts on that.
Doctor, any advice when it comes to landscaping or treating your lawn?
Not really. I think that there are different treatments that you can use in the yard, some of which are more synthetic and are very effective, but they also are going to have some off effects, right? So any of the pollinators that are coming into your garden that you're planting and you're caring for, it's going to potentially hurt that. If you wanted something more natural, there are things like cedar oils and other things that I think are options that people will use. My experience and what I've been told is that these oftentimes need to be reapplied more frequently because they are more organic materials and they break down more readily in the environment.
All right, we'll take our final break and have a final word with our guests after this. Our guests continue to be from the CNY Lyme Alliance, Melissa Carr, Rowe, the Executive Director, and Dr. Kristopher Paolino of Upstate, but of course the Chief Medical Officer for the Alliance. I know that May is an important month for advocacy, but it does allow you to have a little bit more fun. You're doing a lot with the color green. You have your walk coming up at the end of the month. Melissa, talk about all these landmarks we saw green recently.
18 buildings in central New York, all turned green for us on May 1st. You can see some images there. That's the Krause Clock Tower, all over town. It was a very, very exciting night for us. I think what it does is bring very wide visibility to the issue, and people will ask, why is everything green? And the hope is that that starts the dialogue and the conversation about the importance of May for Lyme Awareness Month for us. We're very grateful to all of the organizations that participated with us this year.
That's how you're opening the month of May,
Correct.
but you're ending the month of May with your annual walk.
Yes, we are. So all month long, we're busy running around doing all of the farmers markets and such. And now we will have the walk on May 30th this year at 10 a.m. Long Branch Park. Everyone's welcome. It is a dog-friendly event, so bring your friends, bring your dog. Come out. It's a short walk. It's a 3K as opposed to a 5K. Very manageable for folks. And we'll be out there rain or shine, supporting everyone that's impacted by Lyme and tick-borne disease.
Doctor, such an increase in awareness and advocacy over the past several years. I've noticed it personally. I've been to the walk before. Is it working? Or maybe these increase in visits that these hospitals and other doctors are seeing is because people are aware that if they're bit, they should maybe get checked on?
I think you're right. I think that Lyme has become a big problem in the region, and people are either aware of it because of their own experiences or their family and friends that have experienced some problems with Lyme or some of the other tick-borne diseases. And I think it's also kind of raised some of the awareness of some of the other tick infections that we are starting to see more prevalently in the region, specifically things like anaplasmosis and babesiosis, which may not necessarily cause the long-term issues that Lyme often provides patients with these long-term symptoms, but it also is something that could potentially end up in the hospital if somebody gets severely ill from one of these infections.
All right, well, that is all the time we have. Dr. Kristopher Paolino from Upstate, thank you so much. Melissa, the Executive Director of the CNY Lyme Alliance, thank you both for your public service on this issue. It's really important. For all the hardworking people of News Channel 9, we wish you a wonderful weekend. See you next time.
Download the WSYR Plus app on your TV to stream News Channel 9 for free. Just go to your smart TV, search WSYR Plus in the App Store, and download to start streaming today.